What is the best as needed or PRN medication for anxiety? My name is Dr. Ruth Totten. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And one of the questions that I've gotten a few times on this app is, what is the best medication for anxiety? And so I'm specifically going to be talking about as needed medications, meaning not like an antidepressant that you're taking day after day, but something that you take just when you need it. And it's only going to have an effect as long as the medication is in your system. So there are a lot of different medications that could be used in this capacity. I'm going to talk about a few in this video. One, I'll talk about hydroxyzine, propranolol, gabapentin, Seroquel, and benzodiazepines, which include things like Ativan, Klonopin, Xanax, Valium, but I'm going to lump them all together. So generally our go-to PRN medication for anxiety is probably hydroxyzine, which is an antihistamine. And this is because we consider this to be relatively safe and low risk. I say this with the caveat that there is growing literature showing that there can be cognitive risks of using first generation antihistamines like Benadryl or hydroxyzine on a regular basis. As far as efficacy, this really depends on the person. For some, it totally knocks them out, makes them drowsy, and takes away their anxiety, whereas for others, it's like a sugar pill. Another potential benefit is that it doesn't have too many interactions. Mainly, you just want to be cautious with other antihistamines or sedating medications. The other thing to consider is that it is anticholinergic, so we don't recommend its use for people who have cognitive impairment or the elderly in general. Number 2 is going to be propranolol. So propranolol is a beta blocker, which was originally developed as a blood pressure medication, but it does cross the blood-brain barrier. And so it's also used for psychiatric and neurologic indications as well. So that can include things like migraine prophylaxis, essential tremor, akathisia, anxiety, social anxiety, performance anxiety. This is one of my favorites, and I say that because it's not sedating, it's less likely to cause dependence, and it can be really helpful for those physiologic symptoms of anxiety like rapid heart rate, rapid breathing, tremors. That being said, it's not safe for people who have really low blood pressure or other cardiac conditions. It's important to check with their cardiologist, make sure that it's safe for them and not interacting with any blood pressure or arrhythmia medications that they may be taking. It also does impair mitochondrial functioning, and so I prefer to use it only as needed rather than scheduled, meaning on a daily basis. However, some people do benefit from taking it every day because of things like essential tremor or just their anxiety or migraine prophylaxis, or of course, blood pressure. As far as efficacy, this one can also be hit or miss. For some, it's a great option. For others, it's like a sugar pill. They don't notice any difference. Number 3, gabapentin. So gabapentin is a gabapentinoid, meaning that it acts on the GABA system, which is our relaxation system. It was originally developed as a seizure medication, but it's pretty weak at this, and so it's not usually used as monotherapy for seizures anymore. It is kind of used as a jack of all trades. We use it for neuropathic pain, for migraine prophylaxis, for headache treatment, for anxiety, for alcohol use disorder, for alcohol withdrawal, and a number of other conditions. And it's something that I think doesn't do any one thing particularly well, but kind of does a lot of things a little bit. So when I think about using gabapentin, I'm usually thinking about using it in someone who could benefit for multiple reasons. So maybe they have chronic pain, or they have migraines, or they're also trying to come off of alcohol. In these cases, you may be killing 2 birds with 1 stone. At the same time, we are coming to learn that there are more and more risks of long-term use of gabapentin than we previously realized. Things that are similar to benzodiazepines like dependence, tolerance, withdrawal, cognitive issues. So I am definitely using this with more caution now, and I think other prescribers are as well. Number 3, we'll say Seroquel. And you could also lump in other atypical antipsychotics like olanzapine or risperidone because sometimes people take those as needed, but Seroquel is probably the most common one. This can be helpful for people who have anxiety or issues with insomnia. And at the lower dosages, it's not really acting as an antipsychotic, it's acting as an anxiolytic and a sedative. That being said, it can be quite sedating, so some people really aren't able to tolerate taking this during the day because it just makes them too sleepy. And even at those low dosages, you're still going to have all of the potential metabolic effects, increase in appetite, weight gain, blood sugar, cholesterol issues. So it's definitely not my preferred as an as-needed anti-anxiety medication, but if someone is already taking it like a larger dose at night and it's helpful for them and they want a daytime dose, that's probably the situation during which I might add it. Or if I think they have bipolar disorder or some psychotic disorder and their symptoms aren't completely covered by their current regimen, it's something we could consider, but I don't typically prescribe multiple antipsychotics at the same time. Lastly is the benzodiazepine. So this is lorazepam, clonazepam, diazepam, alprazolam. So these are hands down the most effective as needed medications for anxiety. They also act on the GABA system. So they're triggering your calming neurotransmitter. 9 times out of 10, someone is going to have relief from anxiety. And usually if someone doesn't like a benzodiazepine, it's because they don't like the side effects from it. Not so much that it wasn't effective. So side effects are going to be things like sedation, dizziness, impaired coordination, cognitive issues, memory issues, etc. But the reason that we don't recommend using these long term is because of adverse effects like dependence, tolerance, withdrawal, long-term cognitive issues, risk of falls, risk of neurologic dysfunction, and protracted withdrawal. There's also concerns about risks of misuse, abuse, diversion, etc. So I usually reserve this medication for people who have failed other interventions. And when I prescribe it, meaning when I start a prescription for this, I recommend taking it only as needed and ideally on a short-term basis. If someone is taking it 2-3 times a month, the risks that I mentioned are much, much lower. The problem is that we have lots of people who have been taking these medications every day, multiple times a day for years and years. And this is where you're really getting into those risks that I talked about. But that is a whole topic for another video. So I have plenty of videos on this topic. If you want to check those out, then look at my page. But that's a brief overview of the 5 as needed anxiolytic medications that I typically would use. If there's another one that you found really helpful or another one that you have heard of and you want to hear about, then put it in the comments below. Additionally, if you're interested in getting more direct resources and content from myself, I do have an email list going and I'm sending out bi-weekly emails. So if that's you, then send me a DM with your email and I'll add you to the list.